There. My name is Eric Rosine, and I'm here today to talk to you about borderline personality disorder. So we're going to give you a brief history of borderline personality disorder. Adolf Stein coined the term borderline in 1938 to describe what he believed was a mild form of schizophrenia. This thinking changed in the 1960s and 70s when the belief was transferred from a mild form of schizophrenia to a borderline affective personality disorder, which they believed was close to bipolar disorder. So we're about to take a look at a patient of mine, Alex Harris, who suffers from borderline personality disorder. These are a few of the symptoms.
Can't do it, man. Can't do it. I'm too weak, man.
So Alex was experiencing some severe mood swings, a very common symptom of borderline personality disorder. Other common symptoms include risky behavior, feelings of self-hatred and self-loathing, awareness of destructive behavior, including self-injury, short but intense episodes of anxiety or depression, difficulty controlling emotions or impulses, and even suicidal behavior.
Dr. Rosine, how's it hanging?
It's hanging. How are you doing these days?
I've been better, I've been worse.
I feel you. Tough economy out there, huh?
You said it, my man.
A lot of bargain shopping, a lot of coupons being used.
I need to get me some of those.
Anyway, we're here today to try to get to the bottom of Alex's personality disorder. Let's start off with a few questions.
Let's get to it.
Now, genetics. These play a very, very big role, major role in being diagnosed with borderline personality disorder. Has anyone in your family ever had a mental illness?
I believe I remember my mother telling me stories about how my grandfather, he was bipolar.
Mm-hmm. Now, the reason I ask is because a lot of times, a mental illness runs in the family, and it's very common with borderline personality disorder.
Interesting.
So, environmental factors. Tell me about your childhood.
It was pretty good. I'd say it was normal.
All right, I don't mean to pry, but I've seen a couple of medical records, and you've made a couple trips to the ER as a youngster. A lot of broken bones, bruises.
Yeah, I mean, my childhood was rough. I'm gonna be honest. Grew up. I was adopted when I was born. Bounced around from foster home to foster home, and once in a couple of those foster homes, you could say the foster parent was a little abusive, I suppose.
Mm-hmm. Now, the reason I ask this is because a lot of times borderline personality disorder is developed through a childhood of abuse, neglect, or separation from their caregivers.
Oh, that could do it.
All right, brain abnormalities. Now, you probably don't know too much about these, but a lot of times a low level of serotonin influences borderline personality disorder. Also, areas of the brain involved in emotional regulation, impulsivity, and aggression are typically thrown off by this disorder.
Yeah, I mean, I can't say I know too much about that, but I'll get it checked out by the doc next time I swing by.
All right, I recommend Dr. Bernstein.
Bernstein, where does he work?
North and 5th. So after that heartwarming conversation with Alex, I'm going to talk to you guys about some of the treatments we have for borderline personality disorder. Very commonly, different types of psychotherapy are used, such as dialectical behavioral therapy, cognitive behavioral therapy, mentalization-based therapy, and so on. Now, certain times medications are used to help with some of the things associated with borderline personality disorder, such as depression, anxiety, impulsiveness, but medications can't cure this mental illness. In extreme cases, hospitalization is needed so you can keep a watch on these patients. Now, people with borderline personality disorder are often judged, but often on a wrong basis. Let me tell you some of the myths. By far, the biggest myth is the myth of violence. While social medias have portrayed borderline personality disorder as a very violent mental illness, this is true in a sense, but not in the sense they portray it. They portray it as these people are hurting others. Now, what typically happens is there's an intense hatred for yourself in these type of situations, and these people who have borderline personality disorder typically tend to hurt themselves and not others. Let's take a look and see what Al has to say.
I'm not doing that. I'm not doing that. I'm not whipping myself.
So Alex was experiencing some severe mood swings. A very common symptom of, what's it called?